Hello everyone and welcome to our August condition workshop, where tonight we're going to be learning about how to combine BioTouch with helping TMJ and jaw problems. So you're going to learn the points that you will need to address that and help you through dealing with that condition. By the way, my name is Sherilyn Powelson. I am on staff and outreach coordinator. And it is so wonderful to see you people here tonight. Thank you. Are we sharing? All right. Would anybody like to share what brought him here tonight? Specifically, why BioTouch?
I have it a little bit more, Joe. I'm thinking because I had dental work and left my mouth open, so it went for hours. I was pregnant at the time. And he was like a professional. But I mean, it just happens, right, sometimes.
So because you had dental work, you think you kind of created some jaw problems?
Yeah, because I have this toe stretch.
Yeah.
Or you can, if you sleep on your stomach, maybe, then that would be.
I'm not sure about.
But the jaw. Yeah.
Well, you'll have
When I
some
was
tools.
younger.
You'll have some tools tonight to help address that. Michelle?
What are you here? I am a BioTouch practitioner, but I wanted to come to this because I've been suffering from TMJ for the last 10 months. And I wanted to share that BioTouch has really helped me get through it, because I was in severe pain 24 hours a day, and my pain level was probably around an 8 for many months, for about 4 months. And then I was just like, well, what I'm doing at home isn't helping. I'm going to do some BioTouch. So I started having one of the staff members start doing BioTouch on me, and over the course of the next 2 months, my pain dissipated and is now gone. And I'm still getting BioTouch just to keep up. And, I first turned to natural medicine versus Western medicine. And BioTouch has just really helped. Like, I'm not in pain anymore at all.
Wonderful.
Only when I chew hard foods or tough things, then it'll flare up. But it's just for the second. It's just for the moment, and then it's gone. So I attribute my health to BioTouch for sure.
Wonderful.
Yeah.
That is great. Anyone else have anything to share? No? Okay. Well, at this point, I'm going to turn our workshop over to Bev and Paul and start teaching you the points.
Good to see you. So we have little workbooks we're going to give you all here.
Yeah.
Here's your guys. You guys are husband, right?
Uh-huh.
Yeah. Here's one there. Oh, there you go.
Thank you.
So welcome. Some of you, this is your first time here. You guys have never been here, right? Right? Dan's never been here, right? Have you ever been even in the center?
Yeah.
Oh, okay. Have you ever gotten a session?
Yeah.
Oh,
Okay.
there you go.
He's not new.
So what we do in these workshops is we take, once you get to that little book, the manual, we take a piece of the manual. What we found was when we were doing some PR work, and we sent this to this guy that was interviewing us, the whole manual, and we claim it's really a simple technique, and he when he interviewed us, he went, well, you say it's simple, but there's 17 sets of points in there, and I got really confused.
What? Blew that theory.
So we decided, wow, let's just create little workshops and just pull out 2 or 3 sets of points that address a specific condition, and then that allows people to at least get started, to do at least something they want to work on specifically that they're having an issue with. Do either one of you have a TMJ problem or
Totally, yeah.
totally? Yeah, you do.
Since I was a teenager, so.
Oh, really?
Wow, okay.
And have they done any medical procedures with it, or?
No, I got one of those guards,
Uh-huh.
and that wasn't particularly helpful, so.
Okay.
If I'm in a really, who knows what contributes, I'm sure it's probably stress, but, so sitting up in bed helps. So I sleep sitting up when
Oh,
I'm
really?
in a bad space, because
Oh.
then I can't get that torque on there and it doesn't hurt as bad.
Oh, wow.
But I think I totally cracked the tooth. These teeth on one side all have like hairline fractures and stuff, so.
Okay.
Okay.
And him too.
Oh, you had TMJ?
Yeah.
TMJ problem?
It's never been diagnosed as TMJ, but I've ground my teeth
You
Oh,
got some.
grind
all my
your teeth.
life.
Okay,
Okay.
so
Recently,
just a
a
jaw
tooth cracked eating something soft, so it must have already been
Wow.
cracked. So.
problem. Okay. And Dan, are you dealing with TMJ?
I've got tension in my jaw.
Tension, right,
I don't know
okay.
that it's TMJ.
Yeah, right.
It's like
Yeah, I mean, is there some definitive
No.
thing?
right
that
back
pushes it?
here,
Yeah.
in the back of my head, I've been having these headaches that are kind of feels like it's coming from here and radiating up, but I don't know whether I would call it TMJ. It's just
Right.
a lot of tightness in here.
Okay, wow.
So what we do then is we've also, sometimes we have a speaker. Our speaker today was Michelle, our testimonial.
Yes.
That was good.
You're done.
So it's interesting that you all talked about these different aspects because as we'll go through, we put a little synopsis of what TMJ problems and jaw problems are. So let's just go around, we'll just sort of read it. It says the trimandibular joint. And see, that's the thing that's interesting. People always say, oh, I have TMJ. Well, everybody has TMJ.
Right.
Because you all have a trimandibular joint. So it's actually TMJD if you have that particular disorder, and it's a very specific disorder. So the trimandibular joint is actually two pairs of joints that make it possible for the jawbone to rotate and slide. This joint connects the lower jaw to the skull. The trimandibular joints can be found on either side of the head in front of the ears. These joints allow us to talk, chew, and yawn. Oh, that's good to know.
Yeah.
The lower jaw is rounded ends that glide in and out of the joint socket when you talk, chew, or yawn. These are called condyles. They are covered with cartilage and are separated by a small shock-absorbing disc which keeps the movement smooth. It was interesting when we read all that. It's like, oh, you always hear what this thing is. And TMJ and jaw problems can occur from wear and tear on the cartilage, injuries, inflammation, which is really interesting because we had a woman, what was it on?
It was on joint replacement. You're
Joint
talking about Sally?
replacements.
Yeah.
And she was a nurse and did research and found out that a lot of our joint problems are actually inflammation. Start with inflammation and then the joint starts to deteriorate. So that was like really good to learn. And then of course that's what we found out here with the jaw problems. And then damage to the surfaces of the teeth due to neglect or injury. Loose or lost teeth that have led to damage of the jawbone or poor alignment of the upper and lower jaws. Poor alignment of the teeth or jaw when biting down. This can cause sensitivity of the teeth as well as affecting the muscles in the temporal mandibular joint. Overuse of the muscles of chewing. This may occur if a person chews gum continuously, bites fingernails or pencils, grinds the teeth, has a habit of clenching the jaw, biting the cheek or lip, thrusting the jaw out when speaking, exercising, or other actions like complaining to my wife. No, wait.
Ooh, payback.
Erosion of the improper movement of the disc, damage to the joint from blow or other impact, arthritis, which is really interesting, trigger points in the muscle tissue that cause myofascial pain syndrome, infections deep in the jaw or other dental problems, and tumors. So you can see, everybody was asking, well, I don't know if this is it or that is it. So it's not, it doesn't matter. It's that joint that we're going to be helping you work with, whatever it causes, even if it causes tension in the neck, creates headaches. We're going to address, those are actually the three sets of points that we're going to be dealing with. Most experts agree that treatment should begin with conservative, non-surgical therapies first, with surgery left as the last resort. Therefore, as an integrative modality, BioTouch has been shown to alleviate the symptoms of TMJ and jaw problems. And we have Michelle who gave us that great testimonial. And we've found that lots of times by just doing BioTouch, which is not a huge, it's not like you have to do this 3 times a day for 30 days to notice results. Okay, I mean, we're talking once or twice a week. Man, how often did you get one?
Once or twice a week.
Right. Right. So this is not. It's a pretty much no-brainer, which is the problem of getting this into Western society. It's a no-brainer. It's like you can't put it anywhere. It's too simple. How can something so simple be so effective? We're having a hard time dealing with that as we try to get BioTouch out there to people.
Yeah.
You know, so we're appreciative that you all came here to want to learn it, and our job here is just to be a support system for you. And any questions about the problem itself before we go into? Okay. So for those who've not really ever done it, we're going to start right from the beginning. Now, a lot of what we do in this class is give you a quick synopsis compared to we have a 2-day training or a 10-hour training where we go through the whole thing, more detail of the history. I really give you a song and dance about my history, which I got to do once at an energy medicine conference. That was really fun. But now all of my history and the whole history of how I met the man who created the system is in this little book somewhere.
Where is it?
Is now in this little book, BioTouch Healing with the Power in Our Fingertips, written by one of our certified practitioners. And so she interviewed me, put the history in here, how I met Norman, how I lived my hippie life, and oh, hi, have a seat, Shay. And so it's all in here, and basically this technique was created by a mining engineer in Southwest Colorado. And I met him back in the 80s, actually 89. This is our 30th year that we've been public. And so we're just in that phase of it. Well, we think we're in that phase where it's now going to take off because we got Shay.
Yeah. We need to get maybe one of these.
Oh, yeah. We'll sign you guys up later on that.
Yeah.
So, my name's Paul, by the way. Did we say that? And you're
You
Bev?
mentioned it.
We mentioned it somewhere? Yeah.
Okay, good.
And this is the Paul and Bev show. If you tune in Mondays on Facebook, it's the Bev and Paul show. But I get taught billing at these workshops. That's what I get to talk
And
first.
you deserve it.
Thank you. But now we're going to let Bev talk because we're going to just sort of start teaching you what BioTouch is all about. Now, if you have questions anywhere along the way, just stop us. It's very informal kind of teaching. So. Yes?
A question. So, I have a bad back, that's why I can't hear almost twice. So do the joints regenerate themselves like bones? I mean, like they renew?
Renew. What? I'm not sure.
Like-
You mean the cartilage and stuff?
Yeah,
Or?
like cartilage.
It can.
Joints,
Yes, anything's possible.
yeah.
Oxygen is magic.
Ooh. We knew
See?
we liked you around here for
See?
a reason. Yes. So, and it's interesting because now, of course, there's all these techniques where they're starting to do stem cell therapy, injecting stem cell from fat tissue of your stomach. There's some new patches just made by this guy who does the LifeWave patches, and it's not even out yet, but he's created a patch that actually generates stem cell production. So when you start creating stem cell production, which I'm assuming if they did BioTouch research, they would show that the BioTouch can actually help with that stem cell reproduction, and that's what the body starts generating for these joints and cartilage tissue stuff and stuff. So yes, anything's possible with BioTouch. Well, anything's possible with anything.
Right. Yes.
We're BioTouch junkies, so. Yes?
Okay, so in your little workbooks, let's go to that page 6. We're just going to give kind of an overview. What is BioTouch? For those of you who have not experienced yet. So BioTouch is a really simple technique in that we're using the first 2 fingers of our hands to touch lightly on the skin. The definition of BioTouch is one person touching another person on the skin. So the question always comes up, can you do BioTouch on yourself? And our answer is always, well, just by definition, it's not called BioTouch, but if you can reach those other points, and we say, why not? I mean, if you may be effective, you may not be effective. We don't know. That's our standard answer, by the way. Right, Shane? We don't know. Because it's magical.
But it couldn't hurt.
So, but it can hurt. So, yeah. But if you want to practice, so what BioTouch does is it almost forces us to come into a relationship of healing with another human being. That's what the power of BioTouch is. So let's go to the first bullet. Oh, it's easy to learn. Yes. So tonight, let me tell you that what's going to happen is when you practice together, you and your toys, when you practice together, you're immediately going to be able to help the person that you are giving BioTouch to. Because what happens is, it's a relationship again. So you're going to be practicing with each other, and both of you will be receiving and giving BioTouch tonight, just in the simple sets that we're going to be presenting to you for TMJD and jaw problems. And yes, even children have become certified. It's like Paul was saying the other day, it's almost like BioTouch addresses the child in us. It's so innate in us to want to help another human being, alleviate stress and pain, suffering. That's the only intention, if you want to call it that BioTouch has. You know, we used to say, and we still do, that it's a complementary, not an alternative, but as we progress ourselves in our own awareness, we're beginning to understand that BioTouch is a more of a holistic technique. It begins on the body, for sure. I think of it as a communication system, okay, that goes to the cellular level, but from that, all of our parts begin to open up. So yes, we address the body, as we know. Trauma and pain and disease are held in the body. So it makes sense that we start with the body. We all share a body. We all recognize each other in that body. And so when you step up to another person, that's what's happening. You are entering into a relationship of healing with that other person.
And a key to the holistic part of this is, here at the center, those of us who teach it in this particular center here, is we make no recommendations, we don't diagnose, we really believe that each person knows for themselves what they need. And there's already more than enough information out there on the internet, on all kinds of avenues to go to: massage therapists, acupuncture, all the different other energy modalities. And our only job is to do BioTouch. And then what we've seen with that is we trust that people will come to their own self-awareness. You know, there's a power in this that allows people to hear what they need and have the strength to act on it, which we don't get very many places, you know, and hopefully that's the new trend in healthcare, is giving us the power within ourselves to act on what we know we need to do. So we say, do whatever you have to do. Add this to whatever you're doing, even if you're getting an operation, or sometimes people do BioTouch and they decide not to get the operation. Okay, or they'll go to a chiropractor and the chiropractor will say, oh my gosh, I haven't been able to adjust you. In fact, we're working on a gal now, Amy. The chiropractor's just like blown away how just in the past 2 weeks since she's been getting BioTouch, he's been able to adjust her. And it's staying longer. And we see that all the time with something just so simple like this. And the nice thing is you don't have to come to us. You can just do it at home. You know, that's what's really exciting about this. It doesn't require a center, or like if you learn this today, Dan, you go out and show somebody else how to do it, because you'll be effective and
Immediately.
you'll have the information. So that's what's exciting to us. You know, it's just, it really is a holistic practice to add to whatever you're doing.
Yeah. And I think one of the things that makes BioTouch unique is that, as it says here, there are no levels. Somebody like Michelle, who is a Reiki teacher and practitioner, you know, it's different in that you have to master different levels. Well, the beauty of BioTouch is that you don't. The moment you get it, that's it. There are no levels. You are immediately a practitioner of BioTouch. You can immediately begin to use it, and you are effective. That's the innateness of it that belongs to every single one of us. Every single person on this planet is capable of practicing BioTouch and of helping another human being. So we have no philosophy, we have no belief system. As Paul said, the power of BioTouch is just everyone already has whatever they need inside to make different choices, you know, to take responsibility for your healing.
So we'll show the power of BioTouch with the ball.
Well, go ahead. You're good. Yeah, don't ask me.
So
Oh,
people
he's-
always want to know why you have touch on the skin, and you know, what is the power of touch? And so, because we don't touch through the clothes, and we don't do the energy modality above the skin. We touch right on the skin. And this little ball is a little circuit board in here with 2 batteries, and then these 2 metal plates that come out. And if you touch the 2 balls, I like them. Not a big deal. We'll have you touch one of the knobs there, and I'll touch the other one. And then we're going to touch hands. Now, if I touch it through the clothes, though, I can't get the ball to light. And if I try to do energy work, I just don't have that kind of power to make the connection. But the minute I touch her on the skin, boom. Oh my God, wait till you see this one. Okay, everybody hold hands in a circle. You ain't seen nothing yet.
So it is a little bioenergetic.
All right, and Michelle's gonna put her finger on that. Oh, no, just the finger. There you go. And now we'll touch. And the ball lights. Now you break back there and touch again. There you go. Skin wins.
That's our scientific proof. Why it's important
That's
to
it.
touch on the skin.
I gave
Now that's about
I
as
gave
simple
that
as
at the
you can.
energy medicine conference with
Yeah.
a bunch of PhDs and doctors. That was-
They were totally impressed.
How can you not be?
Yeah. So, you know, there's no preparation time. We just step up to someone and they bare themselves, and BioTouch creates a safe place. So it's like we learn to trust ourselves, not just as a practitioner in touching, but the recipient learns to, you know, just comes into that safe place with another human being. And as we know, there's so many of humanity that is not getting touched on any level. There's so much separation and loneliness and suffering right now that this amazing gift is here to bring us together. So we are really excited about as we pursue this and take it more and more into the world. And we're really happy that you're here tonight. So before we begin to show you, let me say that the only things that you do before you practice BioTouch, you wash your hands. You're going to use the first 2 fingers of both hands, and you're going to hold each point consistently for 6 to 8 seconds. That's it.
So actually reach over and touch one another. Just lightly on the skin. Real light. If you see an indentation, you're too hard.
Just like a butterfly.
And any blood, you're way too hard.
So it
Bruising's not allowed.
it
No
seems
bloodletting.
that the lighter the touch, the more powerful the body feels it. And the body knows what to do with BioTouch. It's innate for it. So, yeah. Do you want to add anything else?
No, except I just feel like I need to tell you, it came from a mining engineer in Colorado who had never done healing work, and he was at a friend's house. This guy was a smoker, chain coffee drinker, and he was at a friend's house. The lady was hemorrhaging, having a miscarriage, and he spontaneously said, I think I can help. And he did a couple of sets of points that came to him, and she immediately stopped hemorrhaging and was able to carry the baby full term. For years, he thought he had a special gift, and he continued to work with people, and then he became burned out, physically, emotionally, spiritually. He was actually in Quartzsite, Arizona. A woman came up from Phoenix, and he just, I can't help you. And that's when he recognized he needed to teach somebody, and he did. He found out that that person was just as effective as he was, and that's when he started to think about, oh, I need to teach other people how to do this. And then we fast forward when I met him in 88, 89, and I became the stooge to say to him, oh, we need to get this out to the public. Because an old timer in this little town said, you know, Norman and Carol brought love to the Mancos Valley. You know, and I'd spent decades looking for love and God and the guru and all that kind of stuff. And here it was in this little town with a bunch of people who would not talk to each other on the streets. I mean, you had Southern Baptists, Mormons, cowboys, ranchers, farm workers, the Indians from Winslow, all sitting in this house together because they all had something in common, which we find is the only common denominator of all humanity. We're all suffering. Everybody's suffering. And everybody just wants a little bit of peace, a little bit of tranquility, a little reason of, what the hell am I doing here? And so when that old man said that, it was like, this is my life work. And it really is. I never get bored doing it. It's just exciting, and it's exciting when people like you want to come and share it with us. So, you know, we hope that you'll get something out of this evening.
He's gone now.
Who?
Yeah, Norman.
God? I thought it was like God.
God, yeah. The engineer.
Norman is dead, yes. He actually died in Safford. Yeah, his son lived in Safford, so. But yeah, he's gone, and actually his wife at that time just died a couple of months ago too. Yeah, so the next lineage, which is interesting because people always want to know about Norman, and what I always liked about BioTouch is it had nothing to do with him, which is why I got involved. It wasn't about a lineage or having to know him. And like I say to people, you know, you really should never believe a guy with a beard, because I might be giving you fake news, right? And I might be Norman. See, because you don't know. See, and so what's important is it doesn't matter the story. What matters is if we give you these points and they work, who cares what the story is? Who cares even if it has a name? Who cares why it works, even though we have all kinds of research data that we'll show you a little bit of? What matters is, can you take this home and do it immediately and be effective? That's all that matters. So, we are going to show you the points. Oh, I guess I'm the stooge.
You are. Our mannequin is at peace and spirit over here for the class. So you continue to be the stooge.
Is my hair okay?
Your hair is fine. So the key to the whole system is called
Can you see it?
the greeting. Oh yeah, Sherilyn, can you?
Yes.
Yes? Okay. So the first set we're going to show you is and present to you is called the greeting. This is the key to the whole system. It seems to just open the body, so unlocks the body. And it sets up a harmony between the associate, the one giving BioTouch, and the recipient, the one receiving BioTouch. So this is going to be the only set that we're going to use one hand. And we designate that hand as your dominant hand. So if you're right-handed, you're going to use that. If you're left-handed, you're going to use it. There's only 2 points in the greeting, so the same hand for both points.
Oh, which by the way, it's on that next page.
What is it? Oh, yeah, it's in your book. Sorry, your workbook. Yeah. So, with your dominant hand, we're going to take the first 2 fingers And we're going to find the first point, which is located just in that soft tissue, just below the bottom of the breastbone or the sternum. And we're going to very lightly put our 2 fingers right there and hold 6 to 8 seconds. That's point 1. Point 2 is on the back. Right at the base of the neck is what we call the big bone. It's designated in the book as a diamond. We're going to locate that at the base of the neck, and we're going to be, get over here, 1 to 1.5 inches to the left of that big bone on the back. And again, the first 2 fingers of your dominant hand, lightly holding 6 to 8 seconds. And now you can do all the other sets, whatever you want to do to address anything that the body is holding. So once you do the greeting, then you can begin. So the sets that we suggest, we can turn to the next page. The first set is metabolism, and as we read in the symptoms of TMJD and jaw problems is some of those are caused by inflammation, broken bones, anything that the body wants to get rid of or to bring in and assimilate. That's what the metabolism set will help to do. So let's do this and show you. So the first step, there's 2 steps. The first step is we're going to be working along the front of the neck, that large muscle, and it's only 3 points. So locate those indentations above the collarbone on either side of that notch. That's going to be points 1 and 1. Again, 6 to 8 seconds, lightly. Points 2 and 2, halfway up the neck, along the side of that large muscle, those large muscles. And then points 3 and 3 at the top of the neck. Now you can always repeat points more than once if you want to do that. But that's the first step. In the second step, we're actually going to have a hold point, which means you're just going to take the first 2 fingers of one hand and maintain constant contact with the skin while the first 2 fingers of the other hand are touching other points. In this case, we're going to find our hold point, which is, if you imagine a line that runs directly between where the nipples on a youth would be, we're going to be on that line and about 1 to 2 inches to the left of the breastbone. Another way you can find that is you can go 1/3 of the way up the breastbone from greeting point 1, remember in that soft tissue? And again, 1 to 1.5 inches, or 1 to 2 inches, I'm sorry, to the left of the breastbone. And then we're going to be touching points on the back that you want to. So I'm going to be holding on the front of the body, and I'm going to be working through the body. So you can see there is a natural curve, the bottom of the ribs, where it joins the spine. We call that the breakover point. I believe it's, you see a little inset there? Shows a little dotted line. That's a breakover point. We're going to actually, we're going to use that as a point of reference. We're going to be touching points around that breakover. So point number 1, we want to stay below the bottom of the shoulder blades, and we want to be working on the large muscles on either side of the spine. So point 1 is on the left spine muscle. I usually don't do it on this side. Point 2 is directly across on the right spine muscle.
Did you also switch your front hand?
No, that's maintaining, that's a hold
Okay.
point. In the front of the book, we give you some terms
Okay.
And so you want to, you're still holding constantly with the other hand while you're touching these points. So point 2 is directly across from point 1, staying below the bottom of the shoulder blades. And that's about 1 to 2 inches above that breakover point. Point 3 is on the right spine muscle, about 2 to 3 inches below the breakover point. Points 1, 2, and 3. And you can repeat these again as many times as you feel like you want to. 1, 2, you're holding 6 to 8 seconds for each point. And that's a metabolism set. And it really helps the body to rid itself of anything that it doesn't want and really assimilate what it wants to bring itself into a more of a balance, a wholeness. So that was a metabolism set. Any questions about the metabolism set?
Yeah.
We're going to be practicing it in the rooms, so you'll be able to experience it. And the next one, Dan, you'll like this one, is the neck set. So all those nerves that go into the head and into the jaw, the neck set will address and really help those to relax and whatever's going on there. So it's a very simple set. We're going to be working along the large muscle on the back of the neck, and we're going to be touching points 1 and 1 again, like we did on the front of the neck. We call this matching fire. We're going to be touching points 1 and 1 in the center of the neck first. Points 2 and 2 right in the at the base of the skull, those indentations on the side of the large muscles. 2 and 2. And then 3 and 3 at the base of the neck. And again, you can repeat those points. This is a really great set. It's for headaches too. The next set, you address headaches, all the nerves that run into the brain, the head, along the neck. Yeah, it will really.
Show a little sweet.
So yeah, this is really great. So once you do the points themselves, which is the foundation of the technique, we have something we'll show you a little bit later. It's called extra work or enhancements. So we have something called a sweep. It's in the terms. It's a slow and deliberate movement across an affected area. So if you want to, after you do the points, you can slowly sweep down the neck, whatever comes to you. And you're just working, giving a little bit more attention to those nerves in the neck. So you can kind of work with that when you're in the rooms. So that's the neck set.
Good stress.
Yeah. So we're going to go out of order just a little bit. We're going to turn to, on the other side of that enhancement local work, we've got the stress anxiety. So of course it says, you know, that clenching of the jaw, we know about 80% of everything's caused by stress. So this will help to alleviate the physical manifestation of mental or emotional anxiety. So it's a very easy set. Again, we're going to find the whole point, which is that soft tissue. It was the greeting point 1. And we're going to be holding lightly just in the bottom of the breastbone. And then we're going to find, it shows in the work book, there's a diagonal line. We're going to imagine a diagonal line that begins at that notch at the top of the breastbone and extends down to where the nipple would be on a youth, on the left breast. And we're going to divide that line into thirds. So point 1 is going to be at the top of the first third. We're going to imagine staying on that diagonal line, again holding 6 to 8 seconds, and point 2 is at the top of the second third. And you can repeat those points as many until you take a breath or they take a breath. It's a really powerful set, but only 2 points. Very easy to do.
I'll show it on Cheryl, local work.
Oh, okay.
Awesome.
Yeah.
Cheryl, why don't you come up here?
Paul's gonna do some.
So, once you've done those basic sets, now you can always take both hands and just do what we call local work. Pretty much 30–40% of what we do is local work. These basic sets of points get you started, but then you just sort of want to, so each of you described the area that hurts you differently. So we want to show you how to now work that area based on the individual. Let's turn you to the side here. Get up. Sit there. Yeah. So as you did the neck, okay, once you do that neck, you can do that extra work. You can sweep it, okay? Sweeping can go any direction. It could go from the middle out or go up. You could also just work on the spine. Okay, so always 2 fingers, and then letting your fingers either do points, holds while you're doing a sweep, okay, or what we call through fire. You might just go right through the neck area. Okay, so what we teach in the class is all the nerves that come off from the spine go to different areas of the body, to the different organs. And we know that all the nerves from this neck go up and deal with all of our facial, sight, hearing, jaw. They all come up from here. So that's why we gave you the neck to do as a place to start. But now you want to do what we call the local work for that specific jaw problem. So the basic idea is you take 2 fingers and you put those fingers on the pain. Okay? So we'll just put 2 fingers on that trimandibular joint. Then you take the other 2 fingers and you always put it somewhere on the back. In this particular situation we're dealing with tonight, that would be the neck. And you just hold that for 6 to 8 seconds. Then you want to do one of 2 things. You want to bring these fingers that are in the back forward to where you're holding on the pain, and you can either do points or you might sweep from this back. Come up around the ear, down into the joint. I might even come from here under the ear. Okay? I might then take both hands and want to sweep. Or I might want to hold here and go from the jaw back to the hold point in the neck. And then I might want to just come to the jaw and maybe work down the whole jaw, especially clenching teeth and things like that. I might want to work both the upper and lower jaws from that joint. And I can do points. I can do sweeps. You know, we only have one rule, and that's don't touch your hands together unless you want to see sparks coming out of their head. 4th of July with BioTouch. Okay? Now, for most people that have jaw problems or headaches or things like that, it usually you got to do both sides. Okay? Because if you just play with one side, then the other side wants to move too, and it's going to, oh my God, I need to let go. So with jaw problems, you usually want to do both sides. And so you just do the same thing again. 2 fingers right on the jaw, 2 fingers somewhere on that neck. And then somehow, whatever comes to you, there is no rules. It doesn't matter. If you're thinking about what you could do, then do it. And if you really want permission, just say, well, Bev said I could do anything. So let her be your guide. And then you just want to keep doing that, okay? Or if it was a specific tooth that broke or hurts, then you might just want to get right to that tooth. I mean, this is great for infections of the teeth. Well, like we heard, there's infection and inflammation in the jaw with these problems. So then you just want to do lightly touching around that area. You might come down into the whole, whatever's in there. What do they call it? Lymph system. You know, and you don't even have to know what a lymph system is. You don't even have to know any of that stuff. If you just start sweeping in different areas, but you just want to go slow and deliberate, and then maybe come back to the neck again. Now the other part, like the headache thing, you might get the headache here and just put 2 fingers with the pain and 2 fingers on that neck. So any of these things that we're dealing in this class tonight, 2 fingers on the pain somewhere in the head area, wherever that is, and then 2 fingers somewhere on that neck, because it's all neck and local work connected. Metabolism and stress helps with the overall well-being of the body. Thanks. Which, if we look at this chart that Kenneth Stevenson did, she shows all these stressors in life, and that for us is it's chronic stress, which is an accelerated aging process, which creates cortisol dysregulation and immune dysregulation. So, jaw problems, arthritis, all these things are immune dysregulation, and there's a naturopath in town who actually won't even work with you unless she checks your cortisol levels, nighttime and daytime, because she says what's happening is we're so whacked out in our cortisol levels, which, you know, we're waking up stressed and then we're going to sleep all hyped, and then in the middle of the day we get tired, so where we should be getting tired at night. So she won't even work with you until she checks your cortisol levels. Well, what Dr. Stevenson found out with her work with hormones and doing BioTouch was, if you put BioTouch into that stress level, and these are all the stressors in life. I mean, when we leave here and drive on Pima, that's it. You got a stressor. And then clenching our teeth, or we go to work, or or we're dealing with our computers, or, So, and then those create all these things that we get. Well, BioTouch actually can reverse those problems and create. Huh?
Who's a naturopath?
I don't know her name. I can't remember. I tried contacting her a couple of times. She gave a talk at AIWC once, and it was really interesting. And I kept trying to get hold of her, like, well, the research shows. She never called me back, so I think she might be into Natural Awakenings. But so the interesting thing is that BioTouch rose interleukin-12 levels, which is an immune system response, and leveled out cortisol, nighttime cortisol levels. Now, if that's all BioTouch does, these problems we're getting, like TMJ and jaw problems and headaches, just by this chart alone shows, God, we can have an amazing result. Besides, Michelle told us, got rid of her problem. So this was really nice research, which to us, 80% of our diseases are based on this stress chart. So BioTouch can have quite an effect for something so easy. Any questions so far? Because we're going to practice. Ready to practice? Okay, she's ready. So why don't we just break up in twos, and then we got 3 teachers. So the 2 of you, and the 2 of you, and the 2 of you take a room, and we'll come in and help you learn these points.